Ever wondered what really goes on behind the scenes in a hospital? Get ready to dive into the untold, jaw-dropping stories straight from the frontline heroes, nurses. From miraculous saves to unbelievable twists, these shocking tales will have you on the edge of your seat. You won't believe what nurses face every day. One of the most insane nursing stories involves a nurse named Sandra who worked in the emergency room. She had just started her shift when a man was rushed in, covered in blood, holding his stomach. He had been stabbed multiple times in a fight. The situation was already intense, but what happened next was beyond shocking. As the medical team worked on stabilizing him, Sandra noticed something odd about the way he was reacting. Despite his severe injuries, the man was oddly calm, almost detached, as if he was in shock. But then, while the doctors were trying to control the bleeding, the patient suddenly began thrashing wildly, screaming incoherently. It took several staff members to hold him down. Sandra quickly realized something was very wrong. The man wasn't just injured, he was having a psychotic episode. They sedated him to try and calm him down, but his condition continued to deteriorate rapidly. His vital signs were unstable, and his breathing became erratic. The team was baffled. Then, during the frenzy, one of the doctors noticed that his pupils were extremely dilated, and there was an unusual odor coming from his mouth. Sandra, who had seen a lot in her time, recognized it immediately. It was the smell of a highly toxic drug, something she had only encountered once before in her career. The man had ingested something incredibly dangerous, and it was causing him to experience severe hallucinations and psychosis on top of his life-threatening injuries. It became a race against time to figure out what he had taken while also managing his stab wounds. Sandra's quick thinking and experience were crucial. She suggested treating him for a potential overdose while they continued to work on his injuries. It turned out that he had ingested a large amount of PCP, a powerful hallucinogen that can cause extreme agitation, psychosis, and, in high doses, can be fatal. The team managed to stabilize him after hours of intense work. He survived, but it was one of those cases that left everyone shaken. Sandra later said it was the combination of the severe physical trauma and the intense psychological effects of the drug that made it the most surreal experience she had ever encountered in her career. Our next story covers the case of Kim Hyatt, a highly experienced pediatric nurse at Seattle Children's Hospital. This story is well known in the medical community and highlights the intense pressures and heartbreaking consequences that can occur in the nursing profession. Kim Hyatt had been a nurse for 27 years and was known for her dedication and skill, particularly in the pediatric intensive care unit. In 2010, she was caring for a critically ill 8-month-old baby who had a severe heart condition. The baby needed a precise dosage of calcium chloride, a medication used to stabilize heart function. On that day, Kim made a fatal error. She miscalculated the dosage and administered 1.4 grams of calcium chloride instead of 140 milligrams. This was 10 times the prescribed dose. Realizing her mistake almost immediately, she reported it to her supervisors and tried to mitigate the effects, but it was too late. The baby's condition deteriorated rapidly, and despite all efforts to save her, she passed away a few days later. The death was devastating for everyone involved, especially Kim, who was overwhelmed with guilt and grief. The hospital conducted an investigation, and although they found that systemic issues contributed to the error, such as the lack of a proper double-check system for medication doses, Kim Hyatt was held personally accountable. She was fired from her job and faced severe professional consequences, including the potential loss of her nursing license. The aftermath of the incident took a terrible toll on Kim Hyatt's mental health. She had always been deeply committed to her patients, and this mistake, which led to a child's death, was something she couldn't bear. Tragically, in 2011, a few months after the incident, Kim Hyatt took her own life. From a nurse that made a tragic error, to a nurse that willingly killed his patients. The next story will shock you. In 2003, at the notorious case of the Angel of Death, a nurse named Charles Cullen was implicated in one of the most shocking cases of medical malpractice. Cullen, a registered nurse with a career spanning 16 years, worked at multiple hospitals in New Jersey and Pennsylvania. Over his career, he killed at least 40 patients, though the actual number may be much higher. Cullen's method of murder was to administer fatal doses of medications, particularly insulin and digoxin, which are used to treat various conditions but can be deadly in the wrong doses. His actions went undetected for years, partly because he often covered his tracks well and because hospital systems failed to connect the dots between the deaths and his presence. The shocking part of Cullen's story is not just the sheer number of victims, but the systemic failures that allowed him to continue working in multiple hospitals despite suspicious incidents and patterns. It was revealed that Cullen had been suspected of wrongdoing at previous jobs, but these warnings were not adequately communicated to other employers. He was finally caught in 2003 after a suspicious death at a hospital where he was working led to an investigation. Cullen confessed to killing many of his patients, describing a compulsion and a sense of power over life and death that drove his actions. His confessions, combined with the evidence gathered during the investigation, revealed a horrifying pattern of premeditated murder. Cullen was sentenced to multiple life sentences in prison without the possibility of parole. His case led to widespread discussions and changes in hospital protocols, including improved monitoring systems and better communication between facilities to track suspicious patterns and prevent such tragedies in the future. Wow, what a journey we've been on today! These stories remind us of the incredible responsibility that comes with being a nurse. Every day, nurses face challenges that test their skills, their resolve, and their compassion. While some stories end in triumph, others leave us with profound reflections on the fragility of life and the importance of vigilance in healthcare. Do you have any experiences or thoughts about the challenges faced by healthcare professionals? Share your stories in the comments below. Let's continue the conversation. If you found this video eye-opening, don't forget to like, share, and subscribe for more content that delves into the world of healthcare. Until next time, stay informed and stay compassionate.